Knock, knock.
Come in.
Hi, how are you today?
I'm good. How are you?
I'm good. My name is Jaden. I'm going to be your student nurse today, and I'm going to provide privacy and do some hand hygiene.
All right.
Okay, so can you state your name and date of birth, please?
Haley McLaughlin. My date of birth is 03/04/03.
All right, and can I check your wristband?
Yes.
Okay, so I'm here to do an HEENT assessment, musculoskeletal assessment, cardiac and respiratory assessment.
All right.
And I'm going to check my orders, and that's what we're supposed to do. So I'm going to start off with the HEENT, which stands for head, eyes, ears, nose, and throat. Starting off, I can see with your head that it is symmetrical, and I'm not seeing anything that's concerning there. Your pigment is consistent with your ethnicity. With your ears, I am seeing that they are symmetrical to your head, and I am going to pull out my pen light. And I'm just going to look into your ears, okay? I have permission to touch you, right?
Yes.
Okay. A little earwax. Not seeing anything concerning. Right. And then with your eyes, I'm going to be checking them to see if they dilate and they constrict and dilate in response to light, and making sure that they're equal. Standing out, that I can see they are equal and round. And I'm going to flash you with some light, okay?
Okay.
Okay. Alright, and your eyes are equal, round. They are reactive to light and they accommodate. Alright, and then looking at your nose, I can see that your nose is symmetrical. There's nothing to be worried about there. Can you do this right here? Breathe in. Alright, and then on the other side, breathe in. Alright, your mouth is symmetrical with your body. I'm not seeing anything there. Can you open your mouth for me? Alright, and I'm not seeing anything wrong with your teeth. Your oral mucosa is pink and as it should be. Alright, and now I'm going to listen to cardiac sounds, and I'm going to check your hands and your feet for edema. And while I'm listening to your heart, I'm also going to go ahead and do your respiratory.
Alright.
So there are, I'm going to listen to your atrial, or aortic, not atrial, valve, your pulmonic valve, your Erb's point, your tricuspid valve, and your mitral valve.
Okay.
Continue. Thank you. Okay. And when I lay the stethoscope on your skin, will you take a deep breath in for me?
Yes.
I'm going to do 4 points anteriorly, 4 spots posteriorly, and then I'm going to listen laterally, okay?
Okay.
Deep breath in. Deep breath in. Now. Can you lift up for me, please? In. Now. In. Now. Alright, now I'm going to move around to the back. In. Now. In. Now. In. Out. In. And out. Okay. Will you take your arm and put it across your chest for me? In. Out. And in. And out. Okay. Everything sounds good. I'm not hearing any signs of any heart murmurs, no presence of S3 and S4. If I had suspected there would be some, I would do the whole cardiac assessment again. but with the bell
Okay.
of my stethoscope instead of the diaphragm. Same with your breathing. It is clear, even. I'm not hearing any adventitious sounds. Going back to your head, eyes, ears, nose, and throat. Some questions I forgot to ask that I'm going to go ahead and rectify. Have you had a head injury within the past 6 months?
No.
Okay, do you have any problems hearing?
No.
Have you started having any blurry vision? Are you finding it hard to see up close or at a distance?
No.
Okay, have you had a runny nose recently?
No.
And do you have any problems swallowing? And I forgot to do this, but I'm going to go ahead and rectify this. I'm going to feel down, and your trachea is midline. And can you swallow for me? Okay. All right. Now I'm going to check your capillary refill on your fingers and your toes, and I'm also going to palpate some pulses, and I'm going to check for edema.
All right.
Okay. So starting out, I'm going to do this hand. Your capillary refill is good. And there's no sign of edema. And I'm going to go ahead and check this pulse. Your pulse is good. And this hand. Edema. I'm going to check this pulse. Good. Your capillary refill is good. Your pulses are rating at a 2 plus. And I'm not seeing any evidence of edema. Now I'm going to check your feet, okay? Is that,
All right.
I can touch your feet?
Yes.
All right. Good. No sign of edema. I'm going to feel your dorsalis pedis pulse. And then I'm going to check your posterior tibial pulse. This one. Good. Good. I'm going to check for edema while I'm down here. Signs of it. All right. Good, good. Have you had any shortness of breath recently? Do you have a family history of heart disease, hypertension, any of that? Okay. Now I'm going to check your range of motion. I'm going to do your elbow.
All right.
All right, and I'm going to have you flex it up. And then I'm going to have you extend it down. Okay. And then I'm going to have you do that against my hand. Go ahead and flex against my pressure. Okay. And then go ahead and extend it against my pressure. Okay. And I'm going to do this arm. Flex it up. Extend it down. Flex it against my pressure. All right, now extend it against my pressure. Okay, and now I'm going to have you do your wrists. Can you flex your wrist down? Okay. And can you flex them, extend them? All right, and then can you hyperextend them back? Okay, good, good. I'm going to now check your ankles. Okay, and can you flex your foot down? And then can you, or plantar flexion, and then you can do dorsiflex up. Okay, good, good. And now can you plantar flex down against my pressure? Good, good. And then dorsiflex up. Good. Same with this one. Plantar flex down. Dorsiflex up. Right, now against my pressure. Alright, and now dorsiflex up against my pressure. Thank you. Alright, and then I'm going to have you do your toes. Can you flex your toes inwards? Good. And then extend them. Good. Same with this one. And then extend. Good. All right. Back to respiratory. You said you're not having any shortness of breath. Have you had a cough recently?
No.
No. Okay. And have you noticed any sort of sputum that's coming up, even if you just clear your throat?
No.
No? Okay. And I'd also like to educate you about the extended spirometer, just in case that need were to arise. It's used to expand our lungs. You would take it, put the nozzle in your mouth, inhale, hold for 2 to 5 seconds, and then release, and you would do it 10 times in an hour. Can you repeat those back to me?
I put it in my mouth. I would inhale, hold for 2 to 5 seconds, exhale, hold for 2 to 5 seconds, and then repeat that every 10 times an hour.
Yes, ma'am. All right. I think that's about it. Is there anything else, any questions you have?
No, I'm good.
All right. Well, I'm going to go make some notes in your chart, and I will get the provider in here to see you.
All right, thank you.
Thank you.